Very good evening, everybody. Meeting again in the session of Materia Medica. Yesterday, we have finished one more remedy, an Indian drug that is Abroma augusta. Wonderful remedy in diabetes mellitus. That's what we have learned. And diabetes with the renal complications, it is a wonderful remedy to be studied. Today, we're going to learn one more important remedy and very important remedy in practice. That is the Abrotanum, the first remedy from Allen's keynotes. It is a remedy from composite family, proved by Dr. Catchell. It is a common name is southern wood. This remedy I have utilized many times, but I want to share two important cases. One case was in the year of 1997. The child was brought to me, nearly about 7, 8 years of child who was brought to me, carried on his by his father, and he was kept in front of me in the on the chair, and he was not able to walk by himself. I thought, what may be the reason? Because there may be many possibilities. When such 8 years child was carried, there are many more possibilities. There might be possibility of muscular dystrophy. There might be possibility of some accident would have happened. There are a number of possibilities. And then they have kept the files in front of me, and he was very thoroughly investigated. And those reports were in last 6 months. He was diagnosed as a case of juvenile diabetes and had a very severe arthritis, specifically of lower extremities, where the joint was swollen. It was absolutely inflamed with effusion over there in one knee. It was too painful for him. All investigations where they have done, generally the ESR was very high. It was nearly about 70, 72, something like that. Then second important thing, that his uric acid levels were also little bit high as compared to the children's. It was nearly about 6.2, like that. And he was running a weakness, tremendous weakness, and his extremities were emaciated completely. So I asked the whole history of the child, how the disease has started, what is the problem, since when it is there, everything. And then the father and mother both were there along with him. Both of them narrated that he was absolutely normal condition 8, 9 months back. Then he had some problem. We went for a trip, and during that trip, he he had outside food. He got diarrhea, and he was shown over there in the during the traveling to one of the physician. He has given certain drugs, uh, and he has given the name of the tablet Ridol. It was famous loperamide tablets were there at that time. So he asked that the doctor asked that give him two tablets that, and thereafter if he had another stools again, then you repeat it one more time. Doctor, what has happened? We have given two tablets and he never had an attack of diarrhea for 24 hours. And we felt he very good because there was no more motion. While returning from the trip, he was complaining that he had a pain in his joints. We are not aware, but during the traveling for nearly about 12 hours, we have traveled, and when we tried to come down from the vehicle, it was impossible for him to come down, and his joints were too much swollen, the knees as well as the joints of feet. And then he was carried, and everyone considered it might be because of traveling such a thing has happened. But next day he had a very severe fever along with that, and then we went to a doctor. Then he suggested that to consult a rheumatologist, and we have shifted to the rheumatologist, and he diagnosed that this is the case of arthritis in children's arthritis. That rheumatism was diagnosed, and they started giving him medicine. After starting their medicines, he felt better for a week, and again there was a problem. Again there was a swelling. So this phenomenon off and on was going on nearly about last 4 5 months, but later on it was so fixed. Now it is not coming down with medicines. Then they have given even the prednisolone in a high dose, but temporarily it relieved, and again he had the problems. So it was very typical for me. Then his uric acid was high, ESR was too much high, and he was absolutely lost weight, and his extremities were emaciated. Then he has uttered one important thing. Doctor, nothing gets digested for him. He consumes a lot. His appetite is very good, but he passes the food particles as it is in his stools. And that was more confirmatory for my prescription. And I was damn sure that it was a case of Abrotanum. So I have given him Abrotanum 200, few doses, day 1, day 2, day 3. Asked them to meet me after week. And I want them, if anything happens, please let me know. Don't give anything. If he gets the diarrhea, let it happen. If he gets any skin manifestation, let it happen. But don't give anything. And after giving Abrotanum 200 for consecutively 3 days, on the 7th day, he had started getting diarrhea again. And his joint pain suddenly becomes relieved. So it was very immediately they called me, doctor, he had a diarrhea. I asked them, how are the joints? And he said, yes, he's able to walk now. It has reduced a lot. And he's feeling much better, but he has 4 5 loose motions since morning. So ask them that let it happen, don't give anything. Only thing you must maintain the hydration. Give him electrolyte solution. And I have explained them how to give that, the homemade electrolytes. And that's all. The case was solved. And the diarrhea remained nearly about 4 5 days. And thereafter it recovered by itself, relieving all the joint swelling, completely vanished. And he again started getting a normal movements of all joints. It was a wonderful experience with the Abrotanum that has happened, and it worked so beautifully in that case. It was interesting to get, yes, whatever is there in our books is very specific. So suddenly check diarrhea leads towards rheumatism. Abrotanum is the remedy. Abrotanum, there are many more alternating symptoms. Rheumatism alternates with hemorrhoids. Rheumatism metastasis towards the heart. There are many more. And that's why this remedy is one of the important remedy one should not forget. Many times you can use it. It is a remedy from psychosyphilitic miasm, even psychotubercular to syphilitic miasm. The mind is very typical of the abrotanum. They are cruel-minded, short-tempered personalities. So let us open the Allen's keynotes. First remedy, abrotanum. Southern node, Dr. Gatchell, who was the prover, composite is the family. Alternate diarrhea and constipation, liontaria. This is first sentence. Liontaria is it stools containing undigested stable food particles is called as liontaria. It means the assimilation is hampered. The GI tract is not able to absorb the food. There is a problem in assimilation. And that's why, even though there is ravenous appetite, it never gets applied to the person. His weight never gets improved. Marasmus of children with marked emaciation, especially of the legs, lower extremity are absolutely emaciated, like iodum, like sanicula, like tuberculinum. This is one more remedy, like natrium muraticum. The skin is flabby and hangs loose in folds. So skin, it looks like shriveled, looks like an old man. There is no tone in the skin. That is very, very characteristic of this remedy. You observe that in children. Yes, there is a skin is hanging loose over there. If it is of a neck, it is natramure. If there is skin hanging over there in the neck, it is natramure and sanicula. In marasmus, head is weak, cannot hold it up, like Aethiusa synapia. So marasmus, where head is absolutely weak and patient is neck is so weak that it cannot hold the head. Marasmus of lower extremities only. Ravenous hunger, losing flesh while eating well. Very typically, it looks like hyperthyroidism picture, iodum, natrium sanicula, tuberculinum. These are very characteristic remedy for this specific symptom. Painful contractions of the limbs from cramps and following colic. So there is severe contraction of the limbs, especially following the colic. If there is a colic followed by a cramps in the extremity. Rheumatism for the excessive pain before swelling commences. So stage of rheumatism. Before the swelling commences, the pain is very much marked and patient is in agony. This is the time when you can think, because it is generally acute attack of gout happens to be like that. From suddenly checked diarrhea, rheumatism from suddenly checked diarrhea or other secretion. Rheumatism alternates with hemorrhoids with dysentery. So alternating symptoms are important. Causative factor is important. The suddenly checked diarrhea or suddenly checked secretions leading to rheumatism, very important feature which on which you can prescribe directly. Gout, it is very important remedy for gouty rheumatism. Joints are stiff, they are swollen with pricking sensation. The wrist and ankle joints painful and inflamed. Very lame and sore all over. So all over there is a pain. It is not only in the joints. All over there is a pain, and pain is of sore character. Itching chilblains. What is chilblain? It has been wrongly interpreted that it is tinnitus. No, these are the eruptions which happens to be there nearly at the ends of fingers, which are caused because of less blood supply to the part, caused because of the excessive cold or exposure to severe cold. This is called as chilblain. This is a very important remedy where chilblains, they are itching. Think of Abrotanum. Agaricus is one more remedy mentioned. Great weakness and prostration and a kind of hectic fever with the children. So there is tremendous weakness, there is tremendous prostration and a kind of hectic fever. Hectic fever means which makes the person exhausted, which makes the children tremendously exhausted is the hectic fever. So great weakness and prostration, a kind of hectic fever with children, unable to stand. So much tremendous weakness happens to be there. Now, the nature of the child is mentioned by Allen, and it's very typical. The child is ill-natured. Ill-natured, they are not giving a good reaction. They are quite irritable. They are quite cross and despondent. They're violent. They are inhuman. That is cruel. Would like to do something cruel, stamping feet on the certain creatures, and they are doing something funny things, and they are so cruel that during the Diwali festival they put the crackers to the tail of the dogs like that, and such type of nature is there with such Abrotanum children. The face which looks old, pale and wrinkled. Opium is another remedy mentioned over there. This old looking is because of dehydration, which is caused over there. Relationship after the hepar in furuncle. This is a wonderful remedy for furuncles. After aconite and bryonia in pleurisy, when the pressing sensation remains in affected side, impeding the respiration. So after aconoid, bryonia, which in the pleurisy you have given, pain has the pleural effusion is settled, but still the stitch is still remaining and it is not going away. One must think of abrotanum, and this is the practical hint given by Allen over there. So a short remedy, but very useful remedy in our practice. I have used it many times. I have used it with emaciated children specifically, which cannot hold the neck, and it looks like that they are dwarf, but they are not dwarf. They are weak because they are losing flesh. They are in spite of eating well. So this is a wonderful remedy one should learn with all its alternating symptoms and its mind. I will suggest go through the Materia Medica Viva by George Vitulkas. He has elaborated remedy in a fantastic way in his book. So you'll understand many aspects. Suppressed diarrhea means suddenly checked diarrhea because of some medicines. If you give the anti-diarrheal remedies, medicines, allopathic medicines, such a thing is called as a suppressed diarrhea or suddenly checked diarrhea. So that's all for today. We have finished one more remedy from the fourth year syllabus and we are going ahead. There are many more, 120 remedies are there for fourth year syllabus. So we have to go like this and we have to learn all the small remedies. Tomorrow we'll meet with another remedy. So that's all for today. Thank you being there and meet tomorrow again with both the sessions. Good night.
Thank you very much, sir.